Hello everyone, welcome to the session today. This is a live question and answer session. Thank you so much for joining in today. So today with us we have Dr. Rahul Khot, who is an eminent arthroscopy and sports medicine specialist. He's been working in SL Raheja hospital and has an immense experience in arthroscopy surgeries and treatment in sports injuries. After his post-graduation, he completed a lot of multiple fellowships from UK and Singapore. After all of this, he has been relentlessly serving his excellency from past 13 years in arthroscopic surgeries. So today we are going to follow this pattern, right? I'm going to ask him a question, he's going to answer, and that is how this entire session is going to be. So the very first question is, what are the common problems with which patients with shoulder injuries present to you with?
Patients which come to arthroscopy or orthopedic surgeon usually come with a history of stiffness, which means decrease in the range of motion, history of trauma, some sports injury related to the shoulder, pain which is radiating to the whole arm, neck pain, or instability of the shoulder.
Okay, thank you so much for answering, sir. What are the common causes for the above mentioned symptoms?
The first and the most common cause is trauma. Second is stiffness due to diabetes. Thirdly, lifting of heavy weight. Fourth, history of fall. Fifth, inflammatory arthropathies.
Okay. So what are the common types of pathologies that are involved in a shoulder patient, and what are these various modes of treatment that can be used?
Usually the patient, we cannot categorize the patient into a specific type of pathology.
Okay.
Usually, I can broadly classify them into 4 types.
Okay.
First thing being the frozen shoulder, most commonly seen in diabetic patients. They usually complain of stiffness.
Okay.
In the early stage, physiotherapy to a certain extent helps the patient. There are other modalities of treatment for frozen shoulder, intra-articular injection. If that does not work, we recommend them manipulation, serial manipulations. But we are not recommending manipulation since it causes severe soft tissue damage. If at all the patient is not responding to the above mode of treatment, or if the patient is not willing for the physiotherapy, we recommend a small arthroscopic surgery, which is called as IGHL release or ligament release procedure. Following frozen shoulder, the second common thing is a labral injury or a Hill-Sachs injury, which is a bony defect in the posterior aspect of the humeral head, which usually occurs in sports injuries or even history of trauma. In cases of sports injury, they are usually recurrent injuries occurring in young adult patient. The treatment for that being repair of the labrum along with repair of the defect which is created in the bone. The labral repair or the slap tear is usually repaired using suture anchors, which can be done arthroscopically, and also filling the defect which is created in the humeral head by a muscle tissue, and we restrict certain degree of range of motion. The third common thing which is seen in elderly group is rotator cuff tear. In the initial stage, if we detect early the rotator cuff pathology, if there is an incomplete tear or a bursal surface tear, we recommend physiotherapy or an intra-articular injection. Rigorous physiotherapy do give good results. In case if the rotator cuff is torn from the humeral head, arthroscopic repair of the rotator cuff is recommended. If at all the cuff is repairable, if the cuff is viable. If the cuff is not repairable, not viable, the patient may need to undergo a shoulder replacement surgery using a reverse shoulder prosthesis. The fourth common cause is shoulder arthropathies. Maybe inflammatory arthropathies, maybe earlier history of trauma, maybe earlier history of any rotator cuff arthropathy. If again in this condition, if the cuff is intact, viable, we advise them total shoulder replacement. But if the cuff is not viable, cuff is not repairable, we advise them reverse shoulder replacement.
Thank you so much for answering that, sir. So moving on to the last question. So what is the prognosis or the results of this particular treatment that a person can expect?
If detected early and if the pathology is not severe, physiotherapy as well as manipulation or intra-articular injection help the patient to a great extent. But if the patient has undergone a surgical repair, the patient has to be conveyed. He will require a long period of physiotherapy, range of motion exercises, maybe 6 weeks to 8 weeks. Sometimes it may extend to 3 months as well.
Okay.
Thank you.
Okay. So that was wonderful, sir. Thank you so much for such an insightful session. I'm pretty sure that a lot of people would have understood how important arthroscopic surgery is. And yeah, thank you so much for being with us.
Thank you.
Thank you so much, everyone.